Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
42-year-old male presents for treatment of opioid use disorder. He has been taking 30 milligram oxycodone tablets 4 to 6 times a day for over a year, and both his personal and professional life are deteriorating. He has received several formal warnings at work about his absences and productivity, and his wife has been clear that she will need to move out with their children until he can get treatment. He seems sincere, but is very concerned about whether or not he can do it. He has tried unsuccessfully to stop on his own and finally realized that he needs professional help, so he made the appointment today. He is in which stage of the Transtheoretical Model of Change? A, Precontemplative, B, Contemplative, C, Preparation, or D, Action? So this is an assessment question, but a very straightforward one. It's asking you very specifically, in which stage of the Transtheoretical Model of Change is this patient who has a disorder, recognizes he has a disorder, has tried in the past to manage his disorder, and now makes an appointment and comes to you looking for outside help? Which stage of change is he in? Recognizing where people are in the change readiness process is hugely important in order for us to be able to provide the most effective care. The Transtheoretical Model of Change, published by Prochaska and DiClemente, very commonly employed, not just in mental health, but in healthcare across the spectrum. But for the psychiatric mental health provider, we do need to understand this model of change, recognize what stage the patient is in, because that drives our most successful intervention strategies. So there are 5 actual stages of the Transtheoretical Model of Change, and even 6, depending on whose interpretation you look at. But Doctors Prochaska and DiClemente are the people that coined this model, that they published it and they named it, and they identified 5 stages: pre-contemplative, contemplative, preparation, action, and maintenance. And in the maintenance phase of any change process, there is likely to be relapse. And so some authors have gone on to extrapolate a 6th stage, which they note as relapse. Prochaska and DiClemente, like I said, the original theorists that designed this model, they identify relapse as part of the maintenance phase. But it makes perfect sense. Each stage of change requires a different intervention from us, the healthcare provider. The pre-contemplative patient is not even thinking about change yet. This might be somebody who has made an appointment to see you about something else entirely. You have some pamphlets about use disorder laying around your waiting room. He's bored, he's waiting, he picks it up to read it. And when you say, "Oh, are you interested in managing a use disorder?" He says, No, there's nothing wrong, no problem. That person's not even thinking about change. The contemplative patient is the patient who is thinking about making a change, but has made no active steps yet to do so. The preparation stage of change is the patient who has taken steps to make the change. Action is actually employing the change, and then maintenance is, of course, the rest of your life. And this applies to anything. I mean, opioid use disorder, it's very obvious. The change is to stop using the opioid. But even if you prescribe something for somebody for anything, I mean, even in the primary care setting, if you put somebody on meds for hypertension or GERD, it still requires a change in their routine. It requires the implementation of that medication into their regimen. And those of you that are primary care providers now know what I'm talking about when I say it's not always that easy. So in any event, this question is really about you recognizing the steps or the stages of the Transtheoretical Model of Change so that you can employ the best interventions to assist the patient. And for this patient who recognizes a problem, has tried in the past to manage it independently, was unsuccessful, made an appointment, and came in to see you today about it, this patient is in the preparation stage. C is the correct answer. He has taken an action in making the appointment with you and keeping it. So he's preparing, he's actively doing things to make the change. Once he actually stops using opioids, that will be the action stage. And then, of course, the rest of his life will be staying, maintaining his abstinence. And that would be the fifth stage of change. So again, the answer to this question is C, preparation. And that's because he has taken steps to affect the change, but he's not there yet. Once he does make the change, that will be action. And it is definitely best served for all of us in the mental health setting to recognize these stages of change and recognize that people need different levels of help along the way. I mean, the pre-contemplative patient, they're not even recognizing the need yet. So they're unlikely to be especially receptive to more aggressive, specific patient education. The pre-contemplative patient, it's primarily our job to make sure they understand that there are options, there are things we can do, and please seek us out if you decide that you want some help. The contemplative patient is beginning to think about it, so is likely going to be more responsive to specific conversation and education and strategies like, what have you tried before? The preparation stage patient has taken steps, and that's where we are now. And so that person clearly acknowledges the need for change and is ready to implement it. And that's someone with whom we can be very aggressive and specific in strategies to support it. And then, of course, action. Making the change is the easy part. Maintaining it then requires an entirely different level of intervention.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.